Yeah. So again, another exciting, we're going to talk about irritable bowel syndrome and, and inflammatory bowel disease. I say exciting only in the sense that, man, so many people are dealing with this kind of stuff that don't even know about it. And again, we're going to do everything I can tonight to just really simplify this process and really create not only there's really two things. One, create some hope, quite frankly, for people that are out there dealing with things like ulcerative colitis, Crohn's disease, irritable bowel syndrome, all the above. There's quite frankly, there's some very significant strategies that we can put in play that I'm going to share tonight that can really, really help change someone's life, quite frankly. And I know that firsthand. So I'm looking forward to do the best I can here to try to make what seems to be at times, especially if you're Googling, a very complicated topic, and we're going to simplify it. So that's the name of the game tonight.
Awesome. I think that is exciting. I mean, if you are someone who's struggling with some of these things, to have some solutions or some light at the end of the tunnel is exciting, right?
Yeah, no doubt about it. I think that's, oftentimes in my clinic, I think last week I talked about how gut issues make up a huge, huge part of what I do now. And I would probably say not just me, most men and women that are doing functional medicine, we're dealing with gut issues. And the idea, or when I get to tell somebody, say, oh yeah, I figure out what's going on, or I have a good idea what's going on, and this is what we're going to do. And in 30 days, 60 days, 90 days, I expect you to, for the most part, feel a lot better, and then, continue to healing. That relief that comes on, comes over them in that moment. Like, are you kidding me? I've been dealing with this for decades, and et cetera. So, so for that very reason, I'm excited to share what we're going to do tonight.
Awesome. Well, now we are live on Facebook, so let's dive in, shall we?
Yeah, let's do it. Let's dive.
Awesome. Well, welcome everybody to another episode of the Health Made Simple show. I'm here today with our host, Dr. Bart Precourt, who has been a healthcare practitioner for over 20 years, practicing a range of modalities, including chiropractic, acupuncture, kinesiology, functional nutrition and supplementation, and lab testing, all out of his clinic, Balance Health Studio in Seagrove Beach, Florida, as well as virtually all around the world. He's also the founder of the Health Edge program, which is a cutting-edge health program for entrepreneurs and executives wanting to take their health to the next level. He works with athletes and celebrities all around the world. And tonight we're going to keep going with this conversation about the gut, so that we can help these people who do have as you said, it's one of the most common things you get, these gut issues in your clinic.
Yeah. So for years now, like the top thing that I deal with, even if it's not the thing that people think we're dealing with, so many things boil back down to the gut. And I truly believe that as we go each and every year, that we're going to see almost every practitioner need to be somewhat versed on gut health and understanding, the role that the gut plays in the overall human body. Heck, if you're tired, it's probably a gut issue. If you're having brain fog, there's probably a gut issue. If you're having, arthritis, there's probably a gut issue. If you're having, I can go on and on and on. And tonight, especially, there's a lot of symptoms that are going to cover. So tonight, Karen, I'm going to cover irritable bowel syndrome, IBS, which is a very kind of a broad scoping kind of diagnosis that are given, and it's very, very broad, kind of generic. And then, but I'm also going to dive into IBD, which is inflammatory bowel disease. So, and those are different things, and we'll go into Crohn's and ulcerative colitis. And we'll try to do all this within the next little bit. But yeah, so been dealing with this for a long time, and it really brings me a fair amount of joy now that I can help those people that I've been dealing with these things literally for years. And, if you do like a Google search about Crohn's and ulcerative colitis, it's pretty much, hey, this is an autoimmune condition. It's idiopathic, meaning we don't know what causes it. So we don't know the cause of the problem, and you just roll with it. And it's not when you get a diagnosis like that, that doesn't feel good, So tonight, if nothing else, I want everyone that's dealt with this, if you're dealing with it personally, I want you to feel good about this conversation, and whether you have to listen to this 5 times over to get it down, or literally reach out and I'll be happy to help you out here. So first, let me just say thanks and hi to everyone. If you're here on Zoom, hello, welcome back. Love having you guys. So again, keep doing your thing, keep sharing it out, keep spreading the love here, especially if you think you know somebody that they might have been diagnosed with irritable bowel syndrome, inflammatory bowel disease, Crohn's, ulcerative colitis, even if they're way down the road, even if they've already had surgeries. So because it doesn't go away, it just kind of keeps beating things up. And I'll talk about that in just a moment. Or if you're here on Facebook, welcome aboard. Nice having you as usual. And for both of the groups here, the Zoom group and the Facebook, you can ask questions. This is an open forum. So if you want, you just type in questions to your, to the comment section or the chat room here, and I'll do my best I can to get to them tonight.
Yeah, awesome. Because you know how painful some of these conditions can be, right? You've had an experience yourself.
Yeah, we were just talking about that a little bit. And I wasn't sure if I was even going to share it, but I will. And I think, and because that's what set me on my journey to, I'm not going to call myself an expert in anything, but what's given me so much experience in gut health and the ability to help so many people is because I lived it. My staff and I, we talk about it all the time. Like for 30 or 40 years of my life, I thought that walking around with a bloated gut with, intermittent constipation and diarrhea, I thought that was normal. Like I didn't know any different. But there was a moment, Karen, probably, I'm just going to roughly tag it and say maybe like 8 or 10 years ago, that things really took a turn for me, which, forced me into a massive self-study of gut health and really how to heal a very, very wounded gut. So long story short, I ended up diagnosed with Crohn's, but let me kind of show you how I got there first. I was having this gut pain, and I believe it was like in January or something like that. I don't know why I think that, but I think there's then. And I remember literally being on my living room floor in fetal position, not even being able to speak. I was in so much pain, and I didn't really understand it, and I'm kind of a knucklehead. So I'm also not one to really ask for help and reach out. Fortunately, I have an amazing, loving wife that was like, yeah, we're going to do something about this. Like, and just because when you're that uncomfortable and that much pain yourself, having dog interference here, it's hard to become your own doctor, and you really shouldn't be. And that's why you always need someone, or it's always nice to have someone in your corner as an advocate. Hold on one sec. So I'm just going to hold P. Diddy here. P. Diddy apparently doesn't like the other dog getting close to her couch. So,
yeah.
Sit right here for a moment. Yeah. So I ended up literally on my living room floor, as close to tears as I possibly could be, because I had such incredible gut pain, like deep, like right in the middle of my body. And when I learned what that was, it was an ulcer. And it was literally meaning a wound, and that was in my gut. And it was basically an open wound cut in there. And it gets that way after years and years and years and years of buildup of having scar tissue. That's one of the things that Crohn's builds up to. So anyways, my wife did what she, any loving wife did. She, got on the phone and called our peeps, and, ended up getting some tests. I got a CT scan for my gut. Awful experience. Just stuff I had to do. And sure enough, they came back and told me I had Crohn's. And I jokingly say this, but I mean it. The moment I had that diagnosis, I was like, oh, I'm fine. I'm going to fix this. And then I was, and it was just weird. I don't know why. I just I needed to identify what it was. And then immediately by kind of knowing kind of what it was, I was like, all right, then we went on a journey. And I'm going to talk about tonight how the journey of healing up ulcerative colitis and Crohn's looks different than so many of the things, the diet that you need for that temporary phase, 30, 60, 90 days, is very different. And we talk about here in Health Made Simple Show often, because we actually can't have a lot of the God's garden stuff. We can't have things like high fibers in nuts and seeds. So, and I'll get into that in just a little bit here. So that was my journey. And then it was just a deep dive. It was literally like, how am I going to heal myself up? And you'll understand this a little later when I make the recommendations. But so for a couple of days, all I really lived off of was this gluten-free bread that my wife would lightly toast and just we would completely lather it in butter and coconut oil. And
what a combo.
yeah, so that was a part of the healing strategy. That was all I could consume for 2, 3, 4 days at a time, in just little itty bitty amounts. So, and I'll get into why that was helping, why it was helpful, and then how we can now advance that, and hopefully, so because it's autoimmune, Karen, I can't come on here tonight and tell people we can cure it. So I'm not telling people that, and I can't say that we can reverse it. Because it's autoimmune, it's labeled as autoimmune, but I will tell you, you can make it part of your past and make sure that it is not interfering with your current life or your future life, as long as you're paying attention and doing the right things for, to make a good, healthy gut.
And I love that, because as you said in the beginning, I think a lot of people get these diagnoses, and I mean, you thought, oh, there's something I can do about it, but a lot of people get told from their doctor there's nothing they can do about it. And so then they just stay with that forever and kind of have to live with it. So hopefully we've got some good strategies to share for people.
Yeah, with this particularly, when it comes to Crohn's and ulcerative colitis, so I'll go through some of the symptoms, and then I want to back up. So you got to keep me on track here tonight. So I want to back up IBS, irritable bowel syndrome, in just a moment here. But some of the symptoms, what'll happen is you'll have diarrhea, you could have bloody stool. Eventually, if it lasts long enough, eventually you have weight loss, and fever could be happening there, especially in Crohn's. I said the bloody stool, and that's a little bit more. You'll see that with ulcerative colitis. You could see cold sores in the mouth with Crohn's. It can create an ulcer anywhere on that in that lining, and that really is the esophagus up to the mouth, down all the way down to the anus. So that can be a cold sore. There can be an open wound anywhere there. Pain, cramping. And I'm talking like serious gut pain, like buckling over. So all of those are part of the symptoms that, and diarrhea, blood in the stool, I think I shared with those. Those are very, very typical for it. Having trigger foods, certain foods that all of a sudden trigger it, and you're like, man, and it really, really hurts. There's a lot of like deep pain in there. So, and we'll go into that just a little bit, but let's back up for just a second here. Okay. And let's talk about irritable bowel syndrome, IBS. I wanted to that because that is a very, very common. We talked about last week, we talked about candida. We talked about a little bit about leaky gut, and we talked about, what else did we talk about there? Like yeast. Yeah. So which all kind of fits in together there. So in this one, irritable bowel syndrome, typically it's kind of a very generic diagnosis, but a lot of people have it. And it can also be, I definitely have a dog issue today. In irritable bowel syndrome, one of the most common things that happens is frequent diarrhea. Like literally, you have no control over it, and you literally it starts to interfere with your life because you can't go out sometimes. And this happens. This is a plague for many people, and there's not a lot of answers that are given out there. And how we handle that is subtly different than the way we're going to handle the other two. So I want the conversation, that the idea of the irritable bowel syndrome, to that this too means there's something wrong with the gut. That was a thing that, was very interesting for me. When all those years and I had a gut issue, I never knew the conversation, never had the conversations with bloating. Like, I was always a thin guy. So I figured, I wouldn't put myself in a gut issue conversation. And I think a lot of people make that mistake. And a lot of other people judge it that way. Oh, you're thin, you don't have any issue. Like, you don't have a gut issue. As your weight has nothing to do with, the health of your gut. So irritable bowel syndrome can come with literally, increased diarrhea. It can come with fatigue, is very, very common for it. Bloating often happens here, and that crosses a line, crosses over to some of the things we saw last week with candida. And really what it is an imbalance in your gut flora. And because it can't really label it as one particular thing, they give it this broad spectrum kind of diagnosis, irritable bowel syndrome. And just their bowels are irritable. They're mad. They're mad because they're just out of whack here. And the reason I want to kind of bring that up is because that situation often leads to these more serious conditions, which is ulcerative colitis and Crohn's disease. And the reason that is because we start to break down the microbiome. we start to interfere with the normal gut flora. And once that happens, Karen, then we really, really open up, Pandora's box for anything to really happen in our body. So interesting thing about the irritable bowel is that people who lean toward anxiety tend to have it more, it's more common. And again, it just goes with that energy. When we are in sympathetic dominance, which is the state of anxiety, like we're wound up in that state, your smooth muscle, your autonomic muscles, like your stomach and your intestines, they also bind up. And that's the interference that it has. So literally, like, we can get ourselves nervous and then have diarrhea. I know this is weird. Yeah, I know it's kind of an odd combination.
That's a thing, right? Especially people do before they go up on stage, before they do like events. It's a right, like when they get nervous or anxious or before something.
Yeah, absolutely. So the other part that I want us to understand about irritable bowel syndrome is that there's 3 primary causes, and there's allergies, there's intolerances, and there's imbalances. And I'll explain those because oftentimes we're out there spending our money or looking for different things, and sometimes the answer is kind of right in front of us. So if you have an allergy to a food, that means you actually have an allergy to a type of protein, and it could be gluten, because gluten is a protein. But allergies always have to be to the protein. Food sensitivities can be to anything. It means your body has had too much of them. Your body's not strong enough anymore or whatever. And you can be sensitive to it. Literally, and I say too much because you can eat a food, let's say chicken, over and over and over and over again, run a food sensitivity test, and chicken pops up as your number one, thing. And that happens as a result of having too much of a good thing. And that's possible. And that's when we can start to generate or create something like irritable bowel syndrome, where you literally irritate the bowels. And again, I mentioned the other part is imbalances. Imbalances happen there's a couple different ways. One, we eat the same foods over and over again. Like in that, I think we all do that to some degree. We eat the same.
Yeah.
You might like kale and spinach, but that's it. Or you chicken, but you don't like turkey, and you eat a little bit of red meat. So we eat the same things over and over again. And that's one of the fastest ways to create an imbalance. We just have nutrient imbalances. Even more so is we create imbalances because we lean in the direction of sugar and carbohydrates. And once we do that, we start to lose out catastrophically across the board of vitamins, minerals, and nutrients. The moment that happens and we stop eating our veggies in our life, then all of a sudden we don't make a great, we don't have a good environment for growing gut flora. We then literally mess up our microbiome. And now we have an imbalance. So now any food can irritate it. So we do food logs. We're like, well, no matter what I eat, it bothers my stomach because now it's in an irritable state. So that is kind of like step 1, irritable bowel syndrome. So what do we do about it? That's a fair question that I think someone should have asked, would come soon. So you're going to see some consistencies in when I talk about irritable bowel syndrome, Crohn's, and ulcerative colitis, and then others won't be so much. The number one consistency upon all of them, absolutely positively, intermittent fasting.
Okay.
So 10 years ago when I had that episode, when I look back at it, and like we should with all things that we have with our health or challenges in our life, look back and what did I learn? One of the things I learned is that everyone kept telling me to eat, and my body told me not to.
Yeah.
So I wasn't fasting back then, Karen. I did not intermittent fast 10 years ago. I was a snacker. I was a grazer. I constantly ate all the time. My wife used to always joke, say, you don't eat, a lot at one time because you're always eating.
Yeah.
And that is the worst, absolute worst thing you can do if you have irritable bowel syndrome, ulcerative colitis, or Crohn's, is to always be eating. So hear me now. You absolutely must intermittent fast. It's what your body wants and it's what your body needs if you have any one of those situations, which is oddly enough also what I talked about last week when I talked about yeast and candida. Yeah. So the big picture here is what I learned in my journey here about gut health. Intermittent fasting is a massive, massive tool. Now,
you're giving your digestive system a break, right? Like a chance to heal, a chance to regenerate a little bit, rather than if you're constantly putting food in, it doesn't have a chance to, heal itself.
100%. It is a timeout. It is a timeout. It's just like an athlete who gets out there and gets beat up or is just doing a good job, but they need a timeout. They need to recover. The other thing, Karen, is this, especially with the two autoimmune conditions, ulcerative colitis and Crohn's disease, is that there's tissue breakdown. There's most likely there's going to be some level of an ulcer involved with both of them. And when we intermittent fast, especially when we get to push it a little bit beyond 16 hours into that 18-hour mark, and sometimes even beyond, we don't start there. And we've talked about intermittent fasting enough on this show where go back and see another episode and like how to, or just check out some of my Facebook posts. I'm always posting how easy it is to start, but don't try to start going 18 hours for your first fast. That's not a great way. You want to build up 12, 14, 16, 18 hours. The beauty here, Karen, is this. Often forgotten in the conversation of intermittent fasting, one of the amazing benefits of intermittent fasting is that it increases new stem cell activity.
Okay.
Yeah, so this is absolutely huge. When we're talking about anti-aging, we're talking about healing the body, really we're doing it with stem cells. So we can activate the stem cells in the body if we have a timeout and let the body do its job. So intermittent fasting across the board is something that, I hold near and true to my heart now when it comes to helping any individual, myself, you, me, anybody, when it comes to gut health management. We need to have timeouts. And for always eating, you don't have a timeout. So I want to give them the example I gave you earlier. In the event that you have an ulcer in your stomach or in your large intestine, and I'll help kind of people figure out like which one. Do you have ulcerative colitis or do you have Crohn's? There's a couple key characteristics. And again, how we manage them is going to be about the same. So imagine having a cut on your knuckle, right? Like right on the top of your knuckle. And you just keep putting it in and out of your pocket.
Yeah.
Eating, you're bringing food back and forth across your scab and you just keep pulling it off. You keep pulling it off. That's when you have an ulcer and your body's desperately trying to heal it. And overnight says, oh, thank you. Like you didn't eat for 9 hours, beautiful. And it starts to lay down a layer of skin and it wants to lay down like 5 more layers. And then on top of that, a mucosal line. And then on top of that, some villi. And then on top of that, some, microbiome and mucus and everything. But it doesn't get that chance because you're always eating. And so it always pulls it off. So we keep having that problem. If you make a little scrape on your knuckle and you keep scraping it off, you'll increase the amount of scar tissue. It's very, very important for us to understand, especially when it comes to Crohn's and even ulcerative colitis. If we keep scraping it off, the body is trying to heal itself and it's going to continue to send tissue to that area to try to heal up that wound. I'd use my other arm right now, but there's a dog stuck like this.
Yeah.
So I'm just using one now. So if you keep scraping off that cut, the body said, man, you need more protection, and it sends more and more scar tissue. That's the innate wisdom. Now that scar tissue binds up the intestines, something that's supposed to be very, very, porous. It's supposed to have a lot of motility to it. It's supposed to be soft and smooth. And now it's becoming very, very rigid because we constantly are essentially scraping it and the body's creating a more and more rigid situation. That scar tissue at some point can actually move and it kind of cracks. That's the you're sitting on the living room floor and you're in gut-wrenching pain because you've actually, it's like tearing your intestines. So what are the options? Now, the traditional medical system say, man, they can give you steroids. That's like the most common thing because it's an inflammatory bowel disease. They're going to try to reduce the inflammation in the body. So they pump in a bunch of steroids. Listen, it's a wonderful medicine for times and places that it's needed, but to live off of it, absolutely not. It literally shuts down the immune system, and there's many other complications that happen with prolonged steroid use. Doesn't fix the situation. And then the other option is where the ulcer is, and it kind of keeps growing in size and shape, and it could be in others. They go in and they cut it out. And that's typical for ulcerative colitis and for Crohn's. And, and I think every one of us knows that that's not a good strategy. That's not towards it. Yeah. And, especially like in ulcerative colitis, like our colon. So if I break down that word, so ulcer, it means that you have a wound, colitis, itis. So you have inflammation. That's what itis means. Inflammation in the colon with an ulcer. So that's what ulcerative colitis means. If you go in there, now the colon is like, just to see how far deep this goes, how deep this goes with our gut health, or our gut goes to other parts of our health. The gut, the colon is responsible for absorbing electrolytes.
Okay.
All right. So it is very common in my history. If I see someone that has chronic diarrhea, loose stool, history of colitis, they have a heart condition, AFib, irregular heartbeat, because they can't hold their electrolytes. They don't hold magnesium. They don't hold, chloride, potassium. So that all gets thrown out of balance because it's flushing right through the body. So gut health and heart health, are they related? Yes. Like everything goes back to how well our gut is functioning. So even nutrients, if the body can't absorb the nutrients, it stops craving them because it doesn't want the excess work. So now the bummer is, if that colon, if you do cut it out, if you do end up cutting it out, we lose part of the body that's supposed to be absorbing our nutrients for us and refeeding the rest of the system. So it's a slippery slope here, as you keep going here. So,
and also you haven't addressed whatever's causing the ulcers, right? So even though you've cut out the ulcers that you've got right now, it's not that your body necessarily going to stop producing more ulcers or having to have more treatments.
Yeah, no, it hasn't been addressed at all. So let me kind of address part of how that happens, and part of the reason that it's considered an autoimmune condition. So when we beat up the gut enough, like in irritable bowel syndrome, IBS, candida, yeast, all these things, leaky gut, we're beating up the body, we're beating up the gut, the microbiome's getting out of balance. Your immune system is trying to help. It's trying to fight, because now you got good bacteria, bad bacteria. Maybe we've taken a round of antibiotics and the bad bacteria is winning a little. Your immune system's responding. Your neutrophils are going up. There's responses in the body saying, hey, we got infections going on here, whatever it may be. And your body's trying to fight these things. Could be parasites, not uncommon. Here's the other thing. Parasites can create the ulcers.
Wow. Yeah. And I mean, they're so common, right? A lot of us have parasites without knowing it.
Yeah, especially with ulcerative colitis down in the large intestine. It's not uncommon that the parasite is actually the one that's making the ulcer, making the hole. All right, where was I? Backtrack here. So with the irritable bowel syndrome and that inflammatory process, part of it's happening because our immune system is trying to create this balance, and it's just out of whack. And there's so much out of whack there that the innate immune system essentially overworks, shuts off. We have another immune system called your adaptive immune system. And maybe by this time, because we've been a year talking about immune system, everyone should be almost an expert. So the innate immune system is just doing its thing. We're not even involved. We don't even know why or how it's doing it. It's just, it like sees something and says, oh, I know what you are. I'm going to figure you out. And then goes in and does its job. And it calls the good guys and neutrophils and basophils and white blood cells. Well, when that one gets shut down, we have kind of a backup system. And the backup system called the adaptive immune system. And that says, oh, look at that body part. It's damaged. And what do we do now? Oh, we got to create inflammation. What people don't know about inflammation is that inflammation is actually a call from the body part to the brain saying, we've got an issue here. Can you send me more nutrients? And the brain responds by sending more tissue to that area, nutrients, vitamins, whatever it may be, to try to heal. So what happens is the innate and the adaptive immune systems are all out of whack because of the microbiome, again, being out of whack. And that could have been because GMO foods, antibiotics, sugar diet, stress, whatever it may be. And now we're calling it an autoimmune condition because from the outskirts, it looks like the body's attacking itself with too much inflammation. So the real thing here is, how do we get to the root cause? How do we identify what's going on here? And if we have this, what is the next phase of, like, how do we heal up this tissue?
Yeah. Okay. And in terms of causes, it's really the causes that are causing the IBS that then lead on to the irritable, inflammatory bowel diseases, right? Is that how they're getting caused?
Say that again, Karen.
So in terms of, you said we're not getting to the cause, but in terms of the cause of those diseases, Crohn's, etc., it is actually kind of starting as IBS. So it's the allergies, it's the imbalances, it's those things that we talked about in the beginning that just get chronic enough to cause these diseases.
Yeah, that's that in a nutshell. Clinically, that's exactly what I'll tell you. If you Google it, it'll still say it's idiopathic, but at some point you have to step back and go, let's look. And that's why that's why we practice. That's why we see patients and we try to learn. That's why we use our own bodies and our own experiences to say, I get that we think it's idiopathic, but is there not some tendencies here? So one of the arguments has always been, well, my family has. It's pretty common that like 1 out of 3 people that have Crohn's has a family member with it. Well, the reality is that family members eat like other family members.
Right. And that's so often the thing, rather than just the genetic link, it's also the lifestyle link, right? If you're doing having really similar lifestyle habits to the other members of your family, potentially you're going to have the same issues.
100%. So like usually there's 1 cook in the house and 4 eaters, so everyone, eating the same thing. So it is that epigenetics that leads to so much of this. So, that it's real important to understand, but the way you said that was spot on, that it is these chronic, long-term, and listen, long-term could be for some people 1 year, 2, 3 years, because some kids get Crohn's. Like it's not uncommon for literally an 8-year-old girl to have Crohn's.
Wow.
But understand, is it possible that her entire life she ate GMO foods, the entire life? 100% it's possible. Is it possible that she was on 20 rounds of antibiotics in the first 2 years? Very, very, very possible. Very, very possible. Is it possible she was on steroids? So when I was young, they didn't use steroids that much. Now it's like candy. So when we start to compile all of this, is it possible that, a 6, 7, 8-year-old person has massive amounts of stress? Absolutely. So like when you compile all the epigenetics with it, we can see why children have it as well. Because I'll get that question. Almost someone says, well, you can't be right here because kids get it too. Well, kids can have chronic issues. When you think about, 80% of their life, they've had poor epigenetics. Then we kind of see things a little bit differently here. And the good news is here too, same thing I said at the beginning here, that I can't just come out here and say we can cure it, but I can say that we can forget our past, and I can say that we don't have to live with our past moving forward. We can learn from it, do our best to fix it up, nurture it, and then move forward. And even if you or someone have been diagnosed with some of these, moving forward is a high possibility without ever having to look back.
Okay, so intermittent fasting, great for IBS and IBD, but other than that, are there different strategies, or are we going to do the same thing for both those types of conditions?
There are different strategies, Karen. So IBS. So, all right, and I'm going to try and make this isn't too confusing.
Okay.
Just like we did the other night with Candida, and that we did with yeast, intermittent fasting, we want a digestive enzyme. The most important one is typically hydrochloric acid, and so the one called Zypan. So that's my favorite there. That right there will help a huge portion of the irritable bowel syndrome. Most of the time, foods coming in that we can't break them down properly, and therefore we can't, everything else is small intestine, large intestine get beat up a little bit. So those are big importance. I love Spanish black radish. That is a supplement we used to just kind of clear out and rake out. And again, that's super, super healthy. Those are important guys. And I also, and I'm mentioning these because these are going to be a little bit different in just a moment here. Then also cruciferous vegetables. Phenomenal. Again, those, they're prebiotics. So things like, broccoli and cauliflower and Brussels sprouts, they also have prebiotics in them. That's what's so amazing about all those high fiber vegetables. And they literally work as a rake. And we do have to be mindful, if you have irritable bowel syndrome, that if you're eating a lot of fiber, is it too much for you? Can you handle the fiber?
Yeah.
And that's where the subtleties start to begin. So intermittent fasting, all 3 of them that I'm talking about tonight, irritable bowel syndrome. And the other 2 are really called, so it's IBS and IBD. IBS and IBD, inflammatory bowel disease. So both of them intermittent fasting. But here's where the big difference changes. No hydrochloric acid for ulcerative colitis or Crohn's.
Okay.
Because we're literally hydrochloric acid is acid. and we have open wounds most likely. So clinically, I rarely will give that to the patient because it can create a lot of discomfort by putting a little acid in an open wound.
Oh yeah.
Yeah. So that's something that I don't necessarily recommend. And how do you know? So here's what's beautiful about it. How do you know? If you take hydrochloric acid and it buckles you over like, holy moly, you just poured acid in my open wound, don't take any more. The good news, it literally will wear off in a couple minutes. So it's not a high risk situation. So if you made a mistake, and I have a lot of patients that be like, yeah, well, I'm taking a digestive enzyme and I have an ulcer. I'm like, well, let's just hold off for a second here, because it could be actually making things worse temporarily. So we want to hold off on those. The number one thing, if you have Crohn's, if you have ulcerative colitis, and everyone write this one down, this is what you must get it right away, and got to start taking it, keep taking it. And it's chlorophyll complex.
Okay.
Chlorophyll
complex. IBS take it or just IBD?
So really just IBD. This is a mandatory for IBD. Quite frankly, it's good for all of us. It's plant's blood. Okay. Yeah. And it's got some other like vitamin A and a vitamin K in it. So super, super, super important here. This will help heal the stomach lining. That's what it does. So what's cool is like, if you ever want to just test this theory. So remember, this skin is the same essentially as the dermis that's on the inside of your stomach lining, inside the intestinal lining. It's dermis. So it's the same if someone cuts their arm, they get a dog bite or something like that. Well, put chlorophyll on and it heals it up. It balances the pH, takes away the pain almost instantaneously. So if you have a stomach ulcer, like up in your upper GI, you can bite a couple of these capsules, chew on them, it gets down in there in short period, like in minutes, it'll down-regulate the pain. I didn't have that 10 years ago. At least, I'm sure it was available. I'm sure some practitioner knew about it, but that would have been really helpful. But that fatty acid was playing the same role. When I was eating the butter and I was eating the coconut oil, that fatty acid, that medium chain triglyceride, was soothing that wound. And this is a very, very important tool for us to use if anyone that has Crohn's or anyone that has ulcerative colitis, is to use things like coconut oil, to use things like butter, to use things like MCT oil, because it'll soothe that lining. And because you're not absorbing your bile salts anymore, oftentimes you're having a very, very difficult time getting enough fatty acids. So you kind of got to give extras. So the number one thing here when it comes to the IBD, the ulcerative colitis, and the Crohn's, number one, intermittent fast. This won't work if you don't do it, at least not in my experience so far. And that, I believe, is why people run into so much scarring and so many issues that it'll lead to. They have no other option just to cut things out. You got to have time to heal. So number one, intermittent fasting. One, piggybacked would be chlorophyll. So they're both number ones. And that is because that is the healing agent here. Then it'll do absolute wonders. Now, go ahead.
Yeah, I was just going to say, now the diet for IBD though is a bit different.
It is, and I'll come back. So there's some things we want to change here. So when it comes to Crohn's and ulcerative colitis, there's a whole list of things we got to cut out, and most people already know this. So for example, if you have Crohn's or ulcerative colitis, you don't eat popcorn. If you do, you're playing Russian roulette. Oh yeah, popcorn, because it gets stuck.
Oh yeah, okay.
Little fistulas. So that's a no-no. But there's a list, and Karen, the beauty is this. I want everyone to hear this one as well. When we intermittent fast and we stop scraping the cut off and we stop what's causing the inflammation, the stomach lining heals fast. So literally 30 days for some people, you've already broken through enough. Put enough layers of dermis back on there that you notice significant changes in your life. 60 days, the majority of people, 90 days for real stubborn cases. But we're talking about something that can change your life.
Yeah. And I mean, people often have been damaging this, as you said, for 1 year, 3 year, 5 years. So the fact that your body can get with the program and heal within 30, 60, 90 days is amazing, really.
It really is. Now, there's some other things, just so I don't forget them. Okay. The chlorophyll, intermittent fast, chlorophyll, and we need a significant amount of vitamin D because you're no longer absorbing it. So these are the other things, so the functional medicine doctors, men and women, we're out there. And when we see like low vitamin D and they say they're doing everything right, but their history also shows some signs of like gut issues. We're starting to connect dots here. And especially when they say they're taking vitamin D and they're still low, that tells me, man, that maybe there's something going on with that colon. You can't absorb the fats. So remember, vitamin A, vitamin E, vitamin D, and K, those are all fat soluble vitamins. And if we don't have good bile salts getting all the way down into the, all the way down into the colon, you're not going to absorb them properly. One of the other things that you'll see in the stool, so in ulcerative colitis, often you will see a little bit of a bloody stool, but you may even start when this all starts to happen, you might start to see stool that looks like more like, I'm just going to call them turds, like little, like they're fatty pellets. And that's us not breaking down and absorbing the fatty acids. They're going right through the body because the bile that your liver and your gallbladder are producing, it's not getting reabsorbed into the body. So those bile salts actually get reabsorbed back into the body after they do their job. It's a pretty efficient system. All right, so let's back up to the diet again here. I know I'm bouncing all over.
Before we move on to diet, what is we've just got a question. What was the dosage of the chlorophyll complex and vitamin D for a Crohn's patient?
Okay, so for the Crohn's patient, I'd have them take 6 to 8 pearls of chlorophyll per day. And I do solid for 30 days. And then the following month, let's say month 1, I'm going to go with 8. Month 2, I'm going to go with 6. And I'm going to stay there. And I'm going to stay there probably for about 4 months. And for many reasons. One, we're actually going to help balance out some of the imbalances of nutrients. Chlorophyll complex is phenomenal. It's literally plant's blood. So it's an amazing nutrient for us. It's vegetable-based, plant-based, and it's a good fatty acid source. So there's so much to do with it. I tell you up front, it's not the cheapest, but it is the game changer. And I only share that because I already know people can be like, oh my God, it's expensive. I know, but it's well worth the expense of being able to heal up. Yeah.
And vitamin D was the other one?
D, 10,000 IUs a day for the first 30 days. And that's about twice the amount that I usually recommend. But if you've got Crohn's, you have a fatty acid, you have a fat soluble absorption issue. So like even we always talk about fatty acids here and how good they are for our brains and our skin, our hair and our nails and all those things. You're not absorbing them like everybody else. So we've got to level them up a bit. And because we also know Crohn's autoimmune, we need vitamin D for the immune system. So during that first 30 days, I like to really ramp that up, and then we'll start to pare it down. So the next month, I might just do 8,000 IUs, then 6,000, and bring it back down to that 4,000 to 5,000 is a nice steady daily dosing anyways. But that'll be 90 days out that we get back down there. So we're going to ramp it up as we're doing these other things as well.
Okay, and if people do have these conditions and just want to connect with you so they can get like a personalized plan, how do they do that?
Real simple. And ultimately, that's probably what I'd suggest. Even though if you listen to these things, and just keep listening, that's what I said in the beginning. And I know this was going to bounce a little bit here and there. You can just keep rewinding this and you'll get the strategies. But if they want to work with me, very simple, Karen, literally just call the office. We set up a Zoom like this. We send you whatever we need, like paperwork. If we need lab testing, we can do that. We can send it to wherever you're at. We get on a Zoom call like this, we walk through it, and then we do some follow-ups. And especially in cases like this, either, every, 4 weeks, 6 or 8 weeks, we'll follow up to make sure that we're moving in the right direction here. Again, because if you're dealing with Crohn's or someone that's dealing with Crohn's, their life revolves around their Crohn's and their ulcerative colitis. And same thing with IBS. So whatever it takes, and I'm telling you, you can do what it takes to get this stuff, and part of your past, not your future. Just do whatever it takes.
Yeah, awesome. And we'll put the contact details in the chat for you guys so that you can do that if you want to. Okay, cool. So diet.
Yeah. So here's one of the kind of the I guess kind of like shockers. We really got to reduce. Hear me out. I know. So I'm always about fiber. We got to cut the fiber out. We got to significantly reduce, especially my favorites, the cruciferous vegetables, broccoli, cauliflower, Brussels sprouts, kale. They're the hardest to break down. They got to go. Because they're so hard to break down, they're very tough on the intestines. We want there to be a rake, but remember, the system's beat up. It's raw.
Yeah.
It's
too beat up now. So we want to add them in where we're at IBS, where we're trying to still kind of heal it and not get to that stage. But once they're super beat up, we need to take them out while we heal. Is
Yes.
that right?
Yes, 100%. So
Yeah.
So those fibers got to go. So then we go, all right, well, now what are we going to eat? We're not going to sugar. We're not going to bread. So a couple other things here. So absolute positively have to go with all IBDs, inflammatory bowel disease, gluten, and dairy. You won't win without it. So now we have four things you won't win without. You got to get rid of gluten, got to get rid of dairy, got to get rid of, and then you got to add chlorophyll, and then fasting. Yes. Those are all musts. Because we know gluten is pro-inflammatory, because we know dairy is pro-inflammatory. And this one, Karen, listen, when I say this includes yogurts. Yogurt's got to go, cheese got to go. They're all going to be pro-inflammatory in this situation. So it doesn't mean forever.
Butter?
What's that?
Butter?
Butter, fine.
Okay.
Yeah, butter, fine. Ghee, better.
Okay.
Ghee, better. Okay. So with those being said here, there the other kind of add-ons here is this. So like in Candida, and I want people to understand, there are different strategies, different like diet strategies for different situations. Our general foundation here on the show is always going to be God's garden. That's the foundation. If we're dealing with conditions like Candida, we got to go absolutely carb-free and sugar-free, right? This situation is different. In this situation, we're going mostly fiber-free. We're getting rid of nuts and seeds and popcorn. So we're eliminating all of that. And then we're adding fermented foods, just the opposite we did with Candida.
Yeah.
This situation, our fermented foods, they're already half digested for us. So things like a little bit of kombucha, things like sauerkraut, like pickles and onions, and those things, those fermented foods become very, very valuable at this point.
Okay.
They're going to help us get nutrients in a much easier way. They're going to be a little bit easier to absorb and digest. So that this is in the beginning, very, very fundamental step where the fibers got to go, but the fermented foods come in. Just the opposite we talked about last week, Karen.
Yeah.
Talked about Candida. And that's why this is why I think sometimes people are saying, man, there's so many different experts on so many different things. It's so confusing. They all say something different. It's these subtleties of why we say one thing or another. So typically it's God's gardens, folks. If it's come from plant root tree, walks in the garden, swims, and say, eat it. But if we have to use something very specifically to heal, use a strategy to heal something very different. Crohn's, you're going to do pretty good in the carnivore-esque world with fermented foods. Okay. And that are very, very easy to digest. So if you're going to have a little bit of vegetables, you're going to make sure that they're super sauteed, they're super warm, they're really broken down. But like a cold kale smoothie, not going to work.
Yeah.
Going to work. Yeah. And listen, I got
salad, big kale salad with cauliflower and seeds and out.
Not going to work. It seems like a great thing, but not going to work temporarily. But are those still the way to eat for humans? Absolutely. But temporarily, we're going to have to pass on that. So warmer foods are always going to be a little bit more inviting for us. So we're going to get our foods broken down, get it done a little bit warmer. And I love things like
you can do soups.
Soups, phenomenal. Bone broth, phenomenal. Yeah. Bone broth, and really what we want out of the bone broth is the collagen. Okay. So that's that collagen every single morning in your cup of tea and your cup of coffee, phenomenal for both, for both the IBDs, for ulcerative colitis and for Crohn's and for IBS for that matter. The collagen is just something that'll help heal up that smooth lining. It does have the glutamine. A lot of people say, well, how about glutamine? Yes, absolutely. That's in collagen. So that's what we like for. So that's a simple, easy at home. We don't have to take another pill for it, but the bone broth every single day. For how long? Yes.
Yeah, well, we can all benefit from that, whether we've got some of these conditions or not, right?
100%.
Like, it's such an amazing thing to put in. We could all do with that source of collagen every day, really. I mean, if somebody did keep that as their habit to continue on with, that'd be a great habit for them to have.
100%. And I want to make sure that I add this other one in here too. So interesting enough, zinc is very important for healing wounds. So The good news is that if you're just listening to this, you're already on zinc, because we just went through this whole pandemic, which we needed more zinc. So most likely, if you're listening to this, you're already taking some of that, which is cool, because zinc helps heal wounds, especially on the intestinal lining. So we gotta make sure we have adequate amounts of zinc, zinc, vitamin D, like I said, and then the good fatty acids. That's why I really do like, when I say fatty acids, that is like a fish oil. So let me go back to diet so people can really kind of see what happens here. The easiest and best are going to be things like salmon, of course, wild caught, because we have some the fatty acids, and we have an easier to break down type protein. So that's going to be very simple. Codfish, very good, because it's so easy to break down for the body. So when we really start to think about it, the easier the food to break down, the better. The easiest, of course, is sugar, but we don't want that, because sugar is pro-inflammatory. So onto the must list, sugar's got to go.
That was a given, really, wasn't it?
Yeah, I wanted to wait like down here just because it's just so obvious that go. So yeah.
Nancy asks why wild caught? Like, when we're talking about fish, why do we want to make sure that it's wild caught?
Yeah, great, actually great question, because there's you gotta like search around for wild caught. There's a big difference.
I really do.
Yeah, and really, to answer that question, is because of what they are fed, those fish. So farm raised fish are fed basically fish feed, and that's not what they would normally eat. And the fish itself it flips their omega panel. There's a lot of reasons of toxins and stuff, but it flips their omega panel, the amount of omega-3s to the 6s and 9s. One of the reasons we spend all that money eating salmon, I don't even know that I think it tastes great, but I know it's great for me, is because of how rich it is in omega-3s. And that's what we want it for. That's what an essential fatty acid is, omega-3s. When we eat the farm raised, they don't have the rich omega-3s. They have rich omega-6s and omega-9s, which are pro-inflammatory. So actually, I'm super glad whoever asked that question, they did that, because there's a huge difference in eating grass-fed beef and like non-grass-fed beef. One is an amazing omega panel. One has one that's pro-inflammatory for the body. So those other those other guidelines that we've talked about, with being grass-fed and organic, they still apply 100%.
Yeah, and maybe more important now, because they're really trying to keep that inflammation down, right?
Yeah.
Through this therapeutic period.
It is an inflammatory disease. So anything that it helps us, like a non-inflammatory diet, is going to help. So we'll go back to gluten for a minute. That really means we cut out all grains.
Yeah.
Bye-bye. Yeah.
Okay. So, and really, even things, what about gluten-free breads or gluten-free products you can buy? So
here's what I'd say. Because I lived off of, for like 4 days, a gluten-free bread with, essentially mostly just coconut oil. It got me through. It got me through the other side. I'm not a huge fan of just going gluten-free replacement products, but in this scenario, gluten-free bread was part of the vehicle that got that coconut oil into my body. There were times, and my wife would attest to this, that I literally was just taking scoops of coconut oil and just eating it. That was the only thing that I was getting into my body. And again, the reason I now know 100% and truly buy into intermittent fasting is that when I was unwell, I didn't want to eat. Like, my body said no, although, and I lost tons of weight. Yes. And I looked feeble, and I was feeble, but it allowed me to live and allowed me to, to heal. So some really, really have to trust the body. And I'm glad that I didn't force feed. And there were times that both my wife and I were like, really need to eat. My body's really saying no, and amazingly, like, all the stuff that, I thought would have came with it, like all the headaches and all that stuff, that didn't happen. And when it did happen, I'd pop a little bit of, a cod liver oil. I didn't have the chlorophyll back then. I don't believe so, but I did have the coconut oil, and I was using that pretty regularly. So if it's organic, like gluten-free bread, roll with it. If that becomes your vehicle to get you to the other side, typically I'm going to say we probably just can find better food sources.
Yeah, it tends to be hard to find a good one. We've got a question on Facebook. how does diverculosis play into these other bowel syndromes?
Very similar, very, very similar, except you probably won't see the ulcers.
Okay.
But talking about an inflammatory process in the diverticuli. So the diet is going to lean more toward what I'm talking about, ulcerative colitis and Crohn's, where nuts and seeds, no, popcorn, no. So I would lean more in the direction of those good, healthy, fats and proteins that are easy to break down, bone broth, collagen, diverticulitis. I mean, it's an itis. It's an inflammatory process. So I need to mention, at least, and most people here, my guests, a lot of our peeps that are followers, every week, they're already using turmeric forte. I wish I had it back then. That would have cut my cycle of pain in half, time-wise. I wasn't using anything, like I was just stopping it, but I wasn't using anything to down-regulate it. And if I had turmeric, if you have any of these itises, absolutely turmeric forte. As much as it's going to help shoulder inflammation, I think it helps the internal organs and things like your stomach lining even more so. So remember that turmeric forte we use is bound it's unique. It's bound to that fenugreek. So it'll absorb into the tissue significantly different than even the ones that are with black pepper and stuff like that. So it's in that one, if you're having an acute episode, 6 a day, like load up on it.
Yeah, love it. All right, we'll add that to the chat too. All right, so we've got fasting, we've got the diet separate for each kind of condition type. We've got some supplements that can help support them. And then really, if they want to get more specific or want to talk through, jump on with a practitioner.
Yeah, absolutely. Yes, absolutely. Just so reach out. And if you know someone else that knows this work and does it, there's, and oftentimes, and I said it when I wasn't well, when you're not well, it's very difficult. Like you can know everything, but you're not well. So like, you don't necessarily make the best decisions. You don't necessarily have the best discipline. So having some accountability and having some coaching through it, it's wonderful. I'm blessed to have, a spouse, a wife that, honestly, she's the doctor when I'm not well, you know what I mean? And then she calls my doctor friends and they all understand and respect it. Like they get it. Like, Bart knows that, but like, yes, but he's on the living room floor, so to have, that don't always try to heal everything by yourself. Like, and that really, Karen, is my takeaway for tonight. When you asked me the last question, I don't know.
Oh yeah. Okay. Don't jump there. Okay, no. Yeah. Well, okay. Let's go into that. What is the one takeaway? What's one action that people can implement right away to move towards their goal of becoming superhuman?
Leading up to this show and then after we talked last week, I was thinking about it. I was like, man, you know what? One of my big lessons back then was to not always try to be my own doctor. And I don't mean like, listen, I practice health and all that, but there's times when we should lay down the sword and just receive. And so it's very important for, every one of us to, at times, allow yourself not to be your own doctor, to be well-educated, is awesome, motivated, beautiful. But at times when you are not well, let go of the reins for a moment. Let someone else take over, listen, and just step through, because that's often what holds us back from healing. Like our own stubbornness. That's my biggest challenge, my own personal challenges on moving forward. So that's what I would say is let yourself, get some help in these scenarios and don't be your own doctor all the time.
Yeah, I love that so much. That rings true for me, even really with some lifestyle habits and things that I don't even have to be sick. Having a practitioner tell me, even though I know it or I've learned it before, having them tell me and then like write it out, that's my plan. Wow, helps so much. So yeah, I love that. Well, thanks everyone again for tuning in. We will be back same time, same place next week for another episode of the Health Made Simple show.
Yeah. So, and just a couple of heads up moving forward, there's a good chance that next week will be a live Q&A because I keep getting a ton of questions. So keep sending them. Facebook, our email, text, just whatever. Somehow in this crazy world of technology, they always end up to my phone or they me. and I will answer those questions. But also look forward to, we're definitely going to be doing a thyroid episode coming up soon. That's been a hot topic lately. So thyroid's always a good one for us to all learn about. All right. With that being said, hey, listen, I appreciate and love all you guys. Keep doing the thing, keep sharing it out, keep spreading love. If you're on Facebook, love having you here on Zoom. Awesome. And of course, we can take deliberate action for our mind, our body, overall wellness. Y'all be awesome.